name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn all about apraxia of speech and how you can support someone who has this condition. You're likely here today because you or someone you love has apraxia of speech. Apraxia of speech is a motor planning disorder in which a person has the language capacity to talk, but the signals between their brain and mouth muscles aren't sent correctly. This can create a lot of frustration. A seemingly simple task that most of us do every day, speaking clearly, can be very challenging for people with apraxia. Apraxia can be something a person is born with, called childhood apraxia of speech, or CAS for short. Apraxia can also happen later in life after an event like a stroke, traumatic brain injury, tumor, or progressive disease. This is called acquired apraxia of speech. Childhood apraxia of speech is estimated to occur in about 1 in 1,000 children. But there isn't much reliable information about the prevalence of acquired apraxia. This is because it can be difficult to distinguish apraxia among other motor difficulties in people who have several diagnoses. Symptoms of apraxia can look similar to other speech-related disorders. One study completed in 2013 found that about 6.9% of all motor speech disorders treated at the Mayo Clinic involved an apraxia diagnosis. However, apraxia wasn't necessarily the only diagnosis. Apraxia of speech can affect many aspects of a person's life. Communication is a vital skill for everyone. Not only does it enable us to convey our thoughts and needs, but it's how we connect and form relationships with others. Fortunately, effective speech therapy treatment is available for apraxia. However, a speech therapist isn't always able to predict how much progress a person will make. As the symptoms of apraxia can differ from person to person, so do each person's treatment goals, progress, and results. To get a better understanding of apraxia, let's take a look at some of its main characteristics. One symptom is inconsistent errors in speech. A person with apraxia may pronounce the same word differently each time they say it. For example, one day they may say a difficult word correctly, but soon after they may have trouble repeating it. People with apraxia may distort their sounds. Because their mouth muscles aren't moving in the right way, sounds often come out incorrectly. Pronouncing vowels can be especially difficult, as well as longer and more complex words. Another characteristic of apraxia is groping for sounds. When trying to say words, people can appear like they're groping and making odd movements with their mouth. They may try saying a word several times before they say it correctly. People with apraxia may struggle with the intonation and rhythm of speech. They may speak in a monotone, omit syllables in words and phrases, or pause inappropriately while speaking. Apraxia may also cause difficulty with volitional movements. A person with apraxia may have a tough time initiating what they want to say, such as asking a question or making a comment. Automatic speech may be easier, such as counting or saying the alphabet. For example, if a person with apraxia is asked, "What's your name?" they may be able to reply easily, since this is a question they've been answering their whole life. But if you ask them to repeat their name after you, that might be more challenging. Finally, people with apraxia may have an easier time moving their mouth for non-speech tasks. For example, someone with apraxia may be able to touch their tongue to their top lip. However, the tongue elevation needed in certain speech sounds may be difficult. So before we wrap up, let's go over the key points we've covered here. Apraxia of speech is a motor planning disorder in which the signals between the brain and mouth muscles aren't sent correctly. Apraxia can be something a person is born with, called childhood apraxia of speech. Or it can happen after an event like a stroke or brain injury. This is called acquired apraxia of speech. The characteristics of apraxia include inconsistent speech errors, distorting sounds, groping for sounds, inappropriate intonation and rhythm of words, and difficulty initiating speech movements. Effective treatment is available for people with apraxia. However, apraxia is different for each person, and it's not always possible to tell how much progress a person will make. Apraxia is a complex disorder, and many people don't understand it well. With this series of videos, we hope to educate and encourage you to help support the person in your life who's living with apraxia of speech.